Hi, I'm Dr. Mitch Chasen, the medical director and founder of Reflections here in New Jersey. And I've always felt that the experience of an aesthetic treatment should be as enjoyable as the outcome. And it starts with consultation. A consultation is incredibly important. It's the opportunity for a patient to come in, to talk about what's bothering them, what they might want to tweak, how they're feeling. It's an opportunity for our patients to come in and interview us, to talk to our staff, to talk to the physicians, to really get an understanding of our capabilities. You're going to have the opportunity to meet with a patient care coordinator, which are individuals who are skilled at providing consultations. And they do this before the actual physician comes into the room. So they're going to be asking you questions about what bothers you and what kind of treatments you've done in the past and whether you've had good results and bad results. That information is going to be very helpful to the physician as they come into the consult room and provide their evaluation and provide their recommendations for treatment. So this is a team-wide approach. That patient care coordinator is your advocate, they're your partner. They're someone that are going to help guide you through the consultation, and they're going to be your point person during that treatment process or afterwards.
Hi, my name is Lisa. I'm a patient care coordinator for Reflections, and I often speak with patients prior to their appointment so that we can match them up with the right physician for the right treatment.
Hi, my name is Amanda. I'm a patient liaison here at Reflections. My job is to make sure you're seeing the right physician and to answer any questions you have during your treatment process.
My name is Kelly and I'm a patient liaison here at Reflections, and my job is to provide support for you throughout your consult, make sure you're seeing the right doctor, and provide you with guidance throughout your treatment process and make sure that it's working for your lifestyle.
You know, I've been doing consults now for 2 decades, and I've done tens of thousands of them. And I always say that every single consult that I do is a new learning experience. And if I stop learning, it's time to retire. So with every patient, I really try to get an understanding of not only what troubles them and what they want to tweak, but what are they concerned about? So what kinds of concerns do patients have before they undergo some kind of aesthetic treatment? Number one is the treatment going to leave me natural appearing? You know, I am afraid of doing something where I'm going to look funny. I'm afraid of doing something where others are going to be able to tell I've done something. So a natural appearing outcome, critical, and that's something we stress. That's our mantra. Number two, is the treatment going to hurt? So patients are very worried about pain. That is completely understandable. And very often these treatments are completely comfortable. But unless they articulate that's one of their concerns, maybe practitioners haven't addressed it enough. So that's important for us to know. What else? Downtime. We all lead these very, very busy lives today, and we have varying degrees to take time away, whether our demands with our families or work or parents or anything else. So knowing how much downtime is very important to us, knowing how much downtime someone can have after a procedure, and that affects what we may offer as a treatment option. What else? Cost, all right? No matter how wealthy anyone is, cost is a big factor, and that's a concern that a lot of patients have. Will I be able to afford this? So again, there's many different things, and thinking about these things ahead of time and coming in prepared to talk about them is the best thing possible, and it helps us put together a program that not only is going to make you look better and feel better, but something that is going to be able to work into your life and whatever that means. So when I look at someone, I'm trying to determine what the cause of the sign of aging or the concern that the patient has and develop a treatment plan that targets that specifically. And that is not only an art, but that's science. And that takes years and years to perfect. So the number one way for physicians to achieve the results they're looking for with a patient is to choose the best candidate. And unfortunately, patients aren't naturally a candidate for every procedure. Our job is to analyze what's bothering them and to put together a set of choices of procedures or technologies that are going to address that issue and make them happy. So what we've become known for at Reflections is honesty and integrity. And when a patient comes in, we're going to level with them. We're going to say, this treatment is going to yield this result. If we're a little more invasive possibly, we can enhance that result. We've grown so much through the years. The number of employees have increased, the number of technologies have increased, but we still handle each and every patient like they're our only patient. The demand for aesthetics is at an all-time high. And that's terrific because we're able to treat patients and make them happy, make them feel better about themselves, make them look more youthful, and just invigorate their mindset. But with this increased demand has been the explosion of many different types of practitioners hitting the scene. Practitioners that have another commitment to a different aspect of medicine, whether it's gynecology, GI medicine, dentistry, gynecology, or dabbling in the field of cosmetic medicine. And we implore our patients to seek care from physicians who live, eat, and breathe only cosmetic medicine. At our practice, we interact with each other. We interact with colleagues. I myself, I go to 14 different conferences a year, and I teach at as many. So I am just immersed in this field. So my job during a consultation is to listen to our patients, to understand what their concerns and desires are, to analyze them, understand their patterns of facial aging, to understand what's causing the problems they see, and to come up with a treatment plan for that patient. I know each of our physicians has a different skill set, and very often I'm trying to put together a physician together with a patient that I know is going to achieve the best result for that patient. We all have different experiences, we all have different devices that we're more comfortable with. And my job as medical director is to make sure there's a fit, there's a match, and that I'm putting patients in the best hands to achieve the safest and best outcomes.